To understand cervical cancer, we must first understand where it lives, how it begins, and why it so often goes unnoticed. Deep within the female reproductive system lies a small, narrow structure called the cervix. The cervix is the gateway between the vagina and the uterus. It opens slightly during menstruation. It protects the uterus from infection. And during childbirth, it opens wide enough to allow new life into the world. Despite its size, the cervix performs one of the most important balancing acts in the body, protecting life while allowing life to begin. So why would cancer start here?
Hell A, wanna learn without the stress. Hell A, welcome to Cartoon Clinic.
Cancer does not appear overnight. Cervical cancer begins slowly, quietly, often without pain. It starts when healthy cervical cells undergo abnormal changes. Instead of growing, dividing, and dying in an orderly way, they begin to multiply uncontrollably. But what causes these changes? In most cases, cervical cancer is caused by a virus known as human papillomavirus, or HPV. HPV is not rare. In fact, it is one of the most common sexually transmitted infections in the world. Most people, men and women alike, will be infected with HPV at some point in their lives. And here's the twist. In most cases, the immune system clears the virus on its own. No symptoms, no long-term effects. But in some people, the virus persists. And certain high-risk strains of HPV, particularly types 16 and 18, can damage the DNA of cervical cells over time. This is how cervical cancer begins. One of the most dangerous aspects of cervical cancer is not its aggressiveness. It is its silence. Early-stage cervical cancer often causes no symptoms at all. No pain, no warning, no obvious signs. As the disease progresses, symptoms may appear. Abnormal vaginal bleeding, bleeding after intercourse, pelvic pain, pain during sex, unusual vaginal discharge. But by the time these symptoms are noticeable, the cancer may already be advanced. Here is where science offers us a powerful gift: screening. A pap smear, also known as a pap test, examines cervical cells for early abnormal changes, long before cancer develops. Another tool, the HPV test, detects high-risk strains of the virus itself. Together, these tests allow doctors to find problems before they become dangerous. This is why cervical cancer is considered one of the most preventable cancers. And yet, millions of women worldwide still lack access to screening. Not everyone has the same risk of developing cervical cancer. Risk increases with persistent HPV infection, early sexual activity, multiple sexual partners, smoking, a weakened immune system, lack of regular screening, long-term use of oral contraceptives, multiple full-term pregnancies. If abnormal cells are detected, further tests follow. A colposcopy allows doctors to closely examine the cervix. A biopsy removes small tissue samples for analysis. If cancer is confirmed, imaging tests determine how far it has spread, a process known as staging. Stages range from stage 1, where cancer is confined to the cervix, to stage 4, where it has spread to distant organs. Treatment depends on the stage, the patient's age, overall health, and whether future fertility is desired. Options may include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. In early stages, surgery alone may be enough. In advanced stages, radiation and chemotherapy work together, attacking cancer cells while trying to preserve quality of life. Modern medicine has come a long way. Survival rates have improved. Treatments are more precise. Side effects are better managed. But prevention remains the most powerful weapon. Perhaps the most revolutionary development in this story is the HPV vaccine. This vaccine protects against the most dangerous HPV strains, including those responsible for the majority of cervical cancer cases. It works best when given before exposure to the virus, which is why it's recommended for adolescents, both girls and boys. Yes, boys too, because HPV does not discriminate, and preventing transmission protects everyone. Despite all we know, cervical cancer remains one of the leading causes of cancer death among women in low-income countries. Why? Limited screening, limited vaccination, limited access to treatment. This is not a failure of science. It is a failure of distribution. A disease that can often be prevented still claims lives. Not because we lack knowledge, but because knowledge does not reach everyone.
Click subscribe, come take a peek. It's smart, it's fun, it's cartoon.